Okay, welcome to Effects of Nutrition and Gut Microbiome in GIST patients. During this seminar, all participants will be in a listen-only mode. There will be a question and answer session at the end of the presentation using questions submitted through the Q&A feature. Please remember that information provided in this web seminar is not intended as a substitute for your physician's guidance and care. My name is Sarah Rothschild. I'm the Executive Director of the Life Raft Group, and I would like to introduce our presenter for today. We'd also like to thank Blueprint Medicines, Genentech, Decipher, and Novartis for their educational grants for today's webinar. So Ms. Bernice Carvajal Lopez is a doctoral student who holds a master's degree in health sciences with a thesis related to the use of technologies in the nutritional and psychological care of patients with GIST. She has a diploma in clinical research and biostatistics at the National Cancer Institute in Mexico. She has experience in healthcare of GIST patients as patient care coordinator from 2014 to 2019, and as a global director since 2020 at Fundación GIST Mexico. Ms. Carvajal Lopez has also collaborated in drafting and review of research articles and book chapters in the area of oncology, with 8 publications to date as main author and co-author in index journals, and has participated in national and international conferences. It is such a pleasure to have her here today, and I'm going to hand this off to her. You can proceed.
Well, good evening to you all. Thank you so much. I would like to start this presentation thanking all the allergy team, and thank you especially to you, Sarah, for your presentation and for inviting me here today. And also, I would like to thank to Rebecca for all your support and in coordinating this meeting. So the topic we decided to talk about was the effects of nutrition and the good microbiome in GIST patients. So let's begin with a little review of the topics I'm going to share with you, okay? We are going to start to talk about a little bit about benefits of a proper nutrition and surgical procedures. Then we are going to talk about a little bit about microbiome and cancer. What about the exercise, which is really important for you all as GIST patients. And we are going to end it up with some general recommendations for you all, okay? So, okay, let me follow with this, okay. Which are the benefits of a proper nutrition? Well, there are multiple benefits in a proper nutrition, but I only chose 5 for this, even for this meeting. The first will be the sense of well-being, okay? Then it also reduces the risk of infections. It increases the wound healing after a surgical procedure when it could be a surgical procedure due to GIST or any other type of surgical procedure, okay? It increases the strength and energy, and it helps tolerate the side effects. Talking about surgery side effects or even about imatinib, regorafenib, or sunitinib side effects, okay? So then if it helps us to tolerate these side effects, it will enhance the adherence to the treatment, okay? The idea of this webinar is for you to go out and to start choosing your food, to make every meal count, okay? To make every meal to count as a wound or as a tool for well-being. Eating right is a decision, okay? But how often do we really think about it like that? Do you really decide what are you going to eat, or you just eat whatever you can find on the fridge, or even eat what your family are eating, or you eat what other members of your family or friends tell you to eat? So let's start with a few tips of how to use your meals or your food or your lifestyle as a weapon or as a tool or for well-being, okay? Okay, let's start with a few tips. After a GIST diagnosis, the first step often is the surgery, okay? And the remaining question after the hospital discharge is often, doctor, okay, thank you so much for all your support, but what can I eat? What can I eat in my home? I don't know if I still be eating the food like I was receiving here in the hospital. Which are the foods who are better for me now, okay? Well, nutrition can be affected depending on the anatomical side of the surgery. or even the type of the surgery the surgeon is providing to you. So nutritional care in patients undergoing gastrointestinal surgery extends well beyond the perioperative period, okay? So screening your malnutrition for malnutrition and deficiency of vitamins and trace elements is fundamental, okay? So the supplementation with protein powders may be suggested in some of the patients. I'm talking about patients who have lost more than 10% of the weight of your own weight. If you have lost more than 10% of your recurrent weight, you might need some protein powders to help you to recover from this weight loss, okay? Another situation you need to be aware of is be aware of dumping syndrome. Okay, the dumping syndrome is very common after a gastric surgery, okay? Some of the symptoms of a dumping syndrome include nausea, vomiting, severe diarrhea, sweating, flushing, lightheadedness, okay, rapid heartbeat, and some patients refer to this as an imminent sense of death. Okay, I know it sounds really terrifying. It is terrifying, but we can prevent this to happen with an assessment of our registered dietitian, okay, after the surgical procedures. And last but not least, please monitor your weight loss, okay? And to prevent deficiency of these trace elements, okay? Okay, then we are going to start talking about the GI tract, okay? The GI tract includes not only my stomach, okay? It includes my mouth, my esophagus, my stomach, my small intestine, and my large intestine, okay? And approximately 92 to 97% of the nutrients consumed are absorbed in the small intestine, okay? And those nutrients includes carbohydrates, proteins, fats, vitamins, trace elements. So I chose this figure to represent you how these macronutrients are absorbed, okay? In the chart 1, as you may see in the section A of the image, you can see where those carbohydrates, proteins, and lipids are absorbed. They absorb mainly in the small intestine, okay? Then in the section B of this image, you can see that most of the trace elements, the most important trace elements, are absorbed in this junction, in the junction of the stomach and the small intestine, including calcium, iron, folates, and the calcium even absorbs here right away in the small intestine, okay? And the section C of this image represents or describes the bile acids absorption. Those ones are very important for us because thanks to them, we can absorb fat acids. Remember good and bad fats? Well, both of them are absorbed here in this part of the duodenum, okay? And at the ileum and jejunum, okay? Mainly in the ileum, okay? This is really important because I'm going to talk about this later, but I want you to point it out, okay? And the cobalamin absorption. Why cobalamin? Cobalamin is better known as vitamin B12, okay? And the deficiency of this vitamin, it might be associated with a type of anemia, okay? As you all may know, or as you may recall, the side effects, the mainly side effects of imatinib, sunitinib, and regorafenib are the hematological toxicities, okay, including anemia, okay? So it is really important if you are diagnosed with anemia, when you go to your GIST specialist, it is really important to defer if this anemia is due to medical treatment with imatinib or sunitinib, or is related to a malabsorption because of my surgical procedure, okay? So this is why I wanted it to point it out. So this figure represents at a large scale what are the nutriments absorbed in which anatomical site, okay? Let's start with the stomach. When you see there is a really few absorption of nutrients, okay? But as you may see in the small intestine, including duodenum, jejunum, and ileum, are absorbed most of the trace elements and the vitamins and even carbohydrates, proteins, and fats, okay? The large intestines is in charge of absorbing some electrolytes and water, okay? So I want you to recall where was your anatomical site when you were diagnosed with yeast. It was a gastric yeast, it was a duodenal yeast, it was a jejunum yeast, it was a colon yeast. So I will give you some tips of how to improve your absorption regarding the anatomical site, okay? We are going to start with gastric yeast, okay? According to gastric yeast, the most important fact for you to know is the intrinsic factor, okay? And how this affects to the absorption of cobalamin. Remember cobalamin? Where? I chose this image to represent you how does it works, okay? Imagine you are in a restaurant, you are with your family, you are having the greatest time of your life, and you order a steak, a delicious steak, okay? You eat this steak and it is good, you don't feel bad, you tolerate it very well, you are having a blast, okay? But what does it happen inside of you? Well, it has really a few steps to absorption, okay? When you eat this meat, okay, the acid in your stomach degrades the meat, okay, releasing cobalamin, okay? Then the parietal cells of your stomach secrete intrinsic factor, okay? This intrinsic factor is mostly, they secreted through the duodenum, okay? So there in the duodenum, the intrinsic factor binds to the cobalamin, okay, to be transported to the ileum, so there they can be absorbed, okay? So they are best friends. They cannot be one without the other, okay? If I don't have enough production of intrinsic factor, cobalamin might not be absorbing well. So this is really important, or this is the reason why I might be having some types of anemia. I might be having ordered an intramuscular of cobalamin because I might not be absorbing it well when I am taking it oral, okay? So which are other types of risks I'm facing when I have a surgical procedure after a gastric yeast? Okay, malabsorption of some other nutrients, and dumping syndrome, which I talked to you before, and this type of anemia, okay? But what can we do? Okay, eat smaller and more frequent meals, okay? This is really important, okay? Avoid foods with a lot of sugar, okay? Because you can have diarrhea if you are eating a lot of sugar because you are not processing it very well, okay? Then drink fluids between the meals, not with the meals, okay? Start eating all your food, start to facilitate your stomach to be absorbed very well, okay? Then when you finish your foods, you can wait 30 to 70 minutes after eating, and then you can start drinking some fluids, okay? The other thing you can do is eat foods high in protein. That might be really, really helpful for you, okay? Too much fiber can be difficult to digest after the surgery, so please be aware of this and avoid dairy foods if you are lactose intolerant. In these particular products of dairy foods, I personally recommend to my patients to avoid the first 3 weeks after the surgical procedure, okay? So because they won't be tolerating it very well, okay? Even if my yeast is in other place, like in the small intestine or large intestine, their products are very difficult to digest. So that might be provoking some inflammation. We are going to talk a little bit about inflammation and how to avoid inflammation and what are the reasons I need to avoid inflammation, okay? So I personally, I recommend to wait a little bit and then incorporate dairy foods slowly in your daily basis, in your diet, okay? Well, okay, then on the other hand, we have small intestinal yeast, okay? When we are diagnosed with small intestinal yeast, the treatment, as you may know, the treatment depends on the tumor burden, okay? Even if the yeast specialist is going to decide if the tumor is not it's small, so they can proceed with a surgery, or then you will need neoadjuvancy with imatinib to make it smaller, okay? But talking about the surgery, due to yeast is an exophytic tumor, the most common procedure needed is a Whipple. Okay, I choose this image for you to represent it to you how or what is a Whipple. Whipple is a multi-organic resection that includes some organs, not only the resection of the duodenum. It includes some of other organs that are near to the yeast or near to the duodenum, okay? They include the gallbladder, the bile duct, the duodenum, and often the head of the pancreas, okay? So some of the side effects of this procedure includes hyperglycemias and fat metabolism alterations, okay? While, do you remember the bile duct and the gallbladder? So as they cut it right over there, you might not be absorbing fat very well. Okay, so it might be really difficult for you. And as long as the pancreas is involved, remember the pancreas is needed to metabolize some carbohydrates. So if the pancreas is involved, you might also be having some trouble metabolizing carbohydrates. So it is really important for you to be aware of your glucose levels, okay? And to avoid sugars and some cereals that might not be helping you with this, okay? So which are other risk factors include, well, malabsorption of some nutrients, all the other nutrients involved, some diarrheas, constipation, sense of feeling full with a little amount of food, okay? And what can we do? Okay, we can avoid foods with a lot of sugar, okay? We can use a non-inflammatory diet, okay? And we can use a low FODMAP diet. You might have listened about this. A FODMAP diet is a diet which is free of gluten, okay, lactose, high fat food, sugars, and some vegetables and fruit. Why? Because all these elements can provoke you some inflammation, okay? So we might want to avoid it, okay? And it is also recommended to avoid high fat foods, okay? I chose this chart for you to represent how this low FODMAP diet works, okay? This low FODMAP diet may help people with gastrointestinal problems, such as bloating gas or irritable bowel syndrome, okay? But it has been really helpful for all my patients when they are diagnosed, even with a colon yeast in the colon or a gastric yeast, to recover from surgery or to copy with the side effects of the imatinib and sunitinib, okay? Because when I am taking imatinib, I might be having diarrheas and all these side effects related to the gastrointestinal, okay? So this type of diet has been really helpful to cope with these side effects for all of our patients, okay? So this chart represents in red, okay, which are the foods that we might need to avoid, and in green, which are the foods that we can enjoy, okay? It's like a trick or treat, okay? So you can enhance your well-being, you can start tolerating very well, you can reduce the inflammation, and you can start to feel better soon, okay? The sooner, the better, okay? So regarding colon cyst, okay, this tumor location is very rare, okay, it may happen. We have patients with cyst in the colon. So colon oversees the absorption of electrolytes and water, as you recall, okay? So which are the risk factors involved? Well, some diarrheas and dehydration, okay? Which are other risk factors? When we have a cyst in the colon, the surgeon often choose an ostomy, colostomy, or ileostomy to prevent infections and to let the colon to heal the sooner. But these ostomies can promote diarrheas, can promote dehydration. So it is really important for you to observe if you are having diarrheas and to prevent dehydration, because dehydration can be really delicate, because you can have acute kidney injury. So it is really important to be aware of this, okay? What can we do? We can increase water intake. We might suggest some electrolytes, okay? And we can use an astringent diet. The astringent diet is similar to the FODMAP diet, but we might be excluding high fever foods, okay, fatty foods, okay, and raw foods. When I have patients that have been recently discharged from the hospital, do a surgical procedure about cyst, even if it is not colon, if it is in the small intestinal cyst or a gastric cyst, I prefer 3 weeks of no raw food, okay? All cooked food, okay, including vegetables and fruits, because we might be a little bit, our immune system might be a little bit depressed. So there are some known and opportunistic bacteria that may not be helping us. So this type of diet might be really helpful if you are through a diarrhea or you have experiencing dehydration due to colon cyst, okay? So, well, another nutritional weapon or tool we can use to enhance well-being before, during, and after the oncological treatment is the microbiota, okay? The microbiota has been associated with not only well-being, but also with increasing the benefits of management and side effects, okay? And it also has been correlated to enhanced clinical response to treatment and being associated with or has been established as a prognostic factor of overall survival for cancer patients. So it is a huge opportunity for us to improve our microbiota and to make it happen and to use it as a tool of well-being, okay? Not only of well-being, but also as a prognosis factor to respond well to the treatment, okay, to imatinib, and even for overall survival, okay? So let's talk about a little bit. First of all, let's define the terms, okay? What are the microorganisms? What is the microbiota, and what is a microbiome, okay? Microorganisms are tiny organisms living in all kinds of environments, okay? The microbiota itself is a community of microorganisms in a specific environment, okay? Imagine my microbiota are a compound, a community of microorganisms in our small intestine, okay? And the microbiome is a collection of genetic material from all the microorganisms that are part of the microbiota, okay? It's the genome of these microorganisms, okay? So the good microbiota, okay, talking about the community of microorganisms that live in my small intestine, in my gut, okay, This good microbiota encompasses a diverse community of bacteria that carry out various very different functions, influencing in overall health of the host. We are the host, okay? We are the host, we are the home of these microorganisms, okay? They love us, they live with us, so we are the host of them, okay? These comprise the nutrient, these microorganisms can compromise, okay, the nutrient metabolism or immune system regulation and can impact on our natural defense against infections, okay? So it is really important to be aware of how is my microbiota growing. It is okay, it is not okay, okay? Well, so let's talk a little bit about inflammation, okay? The presence of certain bacteria are associated with inflammatory molecules that may bring out inflammation in various body tissues, okay? Well, this diagram, as you may see, represents the interrelationships between the good microbiota, inflammation, and some other host-related factors and inflammatory condition, okay? So you can see the inflammation, okay? You can see the good microbiota, but you can also see the host-related factors, okay? Remember, we are the hosts of these little tiny microorganisms, okay? So there are some related factors that can be affecting our good microbiota, okay? Including host genetics, antibiotic use, age, diet, sex, BMI, okay, mode of birth, and even our infant feeding, okay? Our infant feeding can affect us in the adult age. Yes, it can affect our good microbiota, okay? And there are other inflammatory conditions such as metabolic syndrome, multiple sclerosis, inflammatory bowel disease, non-alcoholic fatty liver disease, asthma, and atherosclerosis, okay? So as you can see in this image, it's a bidirectional relationship, okay? So with inflammation depending on this composition, okay? So it can inhibit or stimulate. These factors can inhibit or can stimulate inflammations, and depending on its component, can be affecting some inflammatory pathways, okay? This in turn can promote the onset of various inflammatory conditions. So I can be perpetuating inflammation, okay? I can be aggravating my inflammation because of my diet or my BMA, or because I have been diagnosed before with other inflammatory conditions, okay? So it is really important to take note about this, okay? But how does it happen? Okay, what changes my microbiota or enhances my inflammation in our body? How does it work? Okay, well, I choose this image to let you know, to show you really the simplest way I could find. Okay, let's see this image here. This color in blue, okay, clear blue, represent the mucosal microbiota, my mucosal barrier. As you may see here, it is huge. It is large, okay? It is a healthy mucosal barrier. It has a lot of microorganisms, okay? It has a lot of good microorganisms. So as you can see, pathogens cannot introduce themselves, okay? They are out of my mucosal barrier. But, well, infections, infectious agents, unhealthy dietary habits, antibiotics, radiation, chemotherapy, immunotherapy can cause the depletion of the resident microorganisms, okay? As you can see in the image here before, these microorganisms, this mucosal barrier is not longer big, it's really small. So this alteration gives the chance to transitant microorganisms, okay? Most of them are pathogen and opportunistic, okay? So they breach, as you can see here in the image, in the draw, they breach through the epithelium, resulting in a dysbiosis state, which is that dysbiosis is inflammation, okay? And this biosis state can be displayed by abdominal pain, discomfort, bloating, and even diarrheas, okay? So these symptoms, as you recall, oh, wait a second, abdominal pain, discomfort, bloating, diarrhea, those are the most side effects of imatinib. What are you talking about? Yeah, imatinib can cause some of dysbiosis in my intestinal barrier, but if I use imatinib plus an unhealthy diet plus other risk factor, my dysbiosis would be huge. So I won't be tolerating good my food, okay? So how it is really important for you to notice this so you can promote your intestinal health, okay? You can promote your microbiota homeostasis and to even start to make it, I don't know, I know with imatinib is not going to grow over here, but you can grow over here, okay? And not here to make, to give the opportunity of these opportunistic pathogens, okay? So, but okay, I know it is important, but how can I improve my intestinal health, okay? It's simpler that you may be thinking. You may be thinking, oh my God, I have to go to a specific medical procedure to enhance my microbiota, and I have to, I don't know, anything you can imagine. Well, no, it is simpler than you can imagine, okay? You can do it with diet, okay? I collected this image from a recent review from the Nature, which is a very respected journal worldwide. Okay, so they made a review about all the information published, taking account the association with diet and the microbiota homeostasis. Okay, and several studies have demonstrated and described the therapeutic principles in utilizing, as they named, the food microbiota axis, okay? So I will explain this image for you to be easier to understand. They suggest there are some factors that may be affecting the diet, and the diet can affect some parameters or some factors, okay? Let's start with the host parameters, okay? As host, remember we are the hosts, okay? So we have some parameters that may be affecting our good microbiota parameters, and so may be affecting or may be involved in our diet, okay? Those parameters include demographics parameters, location, environment exposures, genetics, okay, and medical conditions to prevent or to treat. For example, the imatinib, okay, or the surgical procedure because of yeast, or the yeast itself, okay? So these host parameters may affect, okay, good microbiota parameters, okay? So the good microbiota parameters compounds the composition of the microbiota, okay, the function, okay, metabolites, and the growth dynamics of my microbiota. Because if I am ongoing on a medical treatment, my growth dynamics won't be really fast, you know, it will take a little bit of more time to grow this mucosal barrier, you know. But we can use microbiota properties to assess permissiveness or resistance to some foods, okay? And we can also use these microbiota parameters as a prognostic factors or prognostic markers of how you are or not tolerating well food, okay? And also we can use the host properties to assess well-being and the disease progression, okay? Talking about dysbiosis and inflammation, okay? I'm talking here as inflammation. So which are the components of the diet that might be helping me to improve my intestinal health, okay? The timing, okay, how many foods you do per day, the quantity of your foods, the contents of your foods, okay, including micronutrients, micronutrients, prebiotics, probiotics, and all which is involved in my foods, okay? So they suggest in this paper, they suggest that they suggest that a personalized nutrition intervention, okay, can predict with a prediction of the reassessment of the host and the microbiota parameters might be needing for us as GIST patients, okay? Why? Because I need, the GIST is not the standard, the GIST can change. As you may see, I might be recovering for a surgical procedure due a small intestinal GIST. Okay, my microbiota, okay, is changes because of this surgical procedure. So I might need some specific type of diet in this time location. But then, okay, it is really well, we are doing it great, but okay, guess what? You need adjuvancy with imatinib. So we are going to start next week. You are going to take 400 milligrams of imatinib. Okay, so now I am ongoing on a medical treatment. So my microbiota parameters change again, and I might be needing another type of diet, okay? So it is really important for you to get a registered dietitian assessment and to go out with them and ask them for a personalized nutrition assessment, okay? And to help you to cope with all these side effects and to improve your microbiota homeostasis, okay? So talking about microbiota, I mentioned you here in the components some words named biotics, okay? You might have listened before, what are the biotics, which are the prebiotics, which are the prebiotics, probiotics, symbiotics, postbiotics. Where can I find that? What is that? Okay, well, let's start define each of them, okay? First, we are going to start with the probiotics. Okay, probiotics, okay, are live microorganisms that that confer a health benefit, okay, on the host, as we are the host, remember, okay, when administered in adequate amounts, okay. So these are live microorganisms that can be a health benefit. These are good microorganisms, remember, okay, but they are alive, okay, they are alive bacteria, alive microorganisms, okay, and they have to eat because they are alive. So prebiotics are the substances that are selectively utilized by these microorganisms to confer health benefit, okay? It's like the prebiotics are the food of the probiotics, okay? And the symbiotics are the combinations of both pre and probiotics, and the postbiotics are the compounds produced by these microorganisms released from food components, okay? So we are going to focus on probiotics and prebiotics, okay? And we are going to explain you a little bit further. Okay, let's explain the effects of these biotics on good microbiota and cancer inhibition, okay? As you may see, prebiotics, you can find prebiotics in food, okay? You can find them in fruits and vegetables, okay? They are also known as fiber, soluble fiber, okay? So inulina, you may know inulin, you may know inulin. Inulin is a prebiotic, okay? So this type of fiber is known as a critical food for probiotics. Probiotics, you can find probiotics in some dairy foods, but if you are not tolerating well dairy foods, you can also ask for some pharmaceutical forms of these probiotics, okay? So let's focus on prebiotics, okay? Prebiotics have some functions that may help them to inhibit the onset and the prognosis of cancer, okay? These functions include stimulate the growth of friendly bacteria because they are the food of the probiotics, okay, remember? And therefore, the fermentations of the probiotics, okay? So this enhances the production of short-chain fatty acids, which release anti-inflammatory cytokines, suppress the inflammatory pathways, and are known to improve antioxidant system. So therefore, they help to enhance or they promote the healthy mucus layer, okay, and the gut barrier. So they help to grow this mucosal barrier, okay, and therefore they help us to in the inhibition of the onset and the progression of cancer. Okay, they help as a prognosis factor because they are involved not only in the prevention of cancer, not only in the onset, but also in the progression of cancer. Okay, so what about probiotics? Well, the functions of some probiotics are the enhance of growth of beneficial growth microbiomes in our gut. Okay, also a proper functioning of microbiota gut-brain axis, which is another axis named very known in the science area, and they are known to improve host defense system, okay, our immune system, okay, they improve our immune system, they participate in producing normal cell signaling and degradation of carcinogenesis and apoptosis of cancerous cells. As you may know, apoptosis is cellular death, okay? So they together participate in the good microbiota homeostasis, and therefore they regulate our metabolisms, and then therefore they participate in the inhibition and prevention of in the onset of cancer and in the progression of cancer, okay? So beyond the prevention of cancer and the onset of cancer and the prognosis, there have shown other beneficial effects of probiotics administration in the cancer prevention and therapy. The therapy, they have noticed that they have demonstrated to be effective in increased therapy efficacy, as you may see, decreased therapy toxicity. And how do probiotics do it? Well, they do it by balancing good microbiota, boost in our immune system, decrease inflammation, okay, and modulate proliferation and apoptosis. So it is really important for you to notice this, because this maintenance of the good microbiota homeostasis is really important, not only for our inflammation or for the sense of well-being, but it has also been correlated with a prognosis factor. As a prognosis factor, it has also been correlated with progression. It has also been correlated to increased therapy efficacy and to decrease therapy toxicity, okay? So it is really important for us to take note to this. And how do they know it all? By modulating the intestinal barrier, okay, and reducing inflammation. So it is important to take note of this, okay? So, well, I guess it is clear the importance of personalized nutrition, but probiotics have been shown to have other protective mechanisms, okay, against intestinal bacteria and infections, okay? They have these mechanisms through antimicrobial antibodies, improvement of cell junction stability, and increased IgA and increased by activity by B cells, like boosting our immune system, okay? So it is important for us to take note. Okay, I guess it is clear that probiotics, the personalized nutrition is really important for us. First of all, personalized nutrition is really important for us, not only to cope to surgery procedures or the treatment-related side effects, but also to promote microbiota homeostasis and therefore reduce the opportunistic infections, the therapy toxicity, and increase therapy efficacy. But let's remember about the host. We are the hosts, okay, of these little tiny microorganisms. And we as a host, remember, we have some host factors. And in the host factors are involved the lifestyle. So what about the exercise? Do we exercise often? We really do exercise, or we don't really do exercise at all, okay? The American, I'm so sorry. The American College of Sports and Medicine Guidelines of Cancer Survivors recommend exercise not only for cancer survivors, but also for patients ongoing oncological treatment. They recommend 3 types of exercises. Okay, aerobic exercise, resistance exercise, and flexibility exercise. Okay, they recommend to mix and match, okay, these types of exercises. Okay, the aerobic exercise, they recommended to do it 150 minutes per week, resistance exercise 2 days per week, and stretch the major muscle groups you can stretch. Okay, it is really important to notice exercise because in fact, exercise is known as the gold standard treatment, not only the only one, but the best option of treatment for cancer-related fatigue. Do you recall fatigue? Do you recall cancer-related fatigue? Okay. Remember, fatigue is the main side effect of GIST. So, well, for GIST and of the imatinib treatment, okay? So we can practice exercise, okay? But which type of exercise I can do at home, which type of exercise I can do. I have to run a triathlon, I have to run a marathon. No, let's explain a little bit of this, okay? This association recommends an exercise of 3 METs per day, okay? But what are the METs, okay? Well, METs are the metabolic equivalents, okay? I'm so sorry. 1 MET is defined as the energy you can use when you are resting, okay? Or when you are sitting still, okay? When you are like, oh, I'm here resting, okay? This is a 1 MET, okay? But an activity that has a value of 3 METs, okay, means that you are exerting 3 times the energy that you would be using if you were sitting still, okay? So they recommend you to do at least 3 times METs, okay, 3 METs of exercise, okay? Well, which types of exercise exert the 3 METs, okay? Walking your pet, okay? Doing yoga, stationary bike, stretching at home, or even swimming, okay? This association also recommend at least 30 minutes of moderate to vigorous physical activity over and above usual activities. This is important because I have some patients that tell me, oh yeah, I clean my house, so I am working out. I know it's exhausting cleaning your house, I know it, but it is important for your brain to recall, for your brain to notice you are working out. So it is fundamental for us to do these activities over and above usual activities, okay? They also recommend 45 minutes to 60 minutes of intentional physical activity is preferable, okay? Let's notice again, intentional physical activity is preferable, okay? Remember, your brain needs to register you are working out, so it is preferable, okay? Then, guess what? Exercise has been related not only with the fatigue relief, but also to induce changes in good microbiota, okay? The better your cardiorespiratory fitness, the higher your abundance of good bacteria you have in your gut microbiome. So it is really significant for us to try to work out in our places. You don't have to run a marathon. You can start walking your pet. You can start stretching at home, but please make it as your daily basis so you can improve not only your fatigue, but your whole sense of well-being, okay? And you can improve your microbiota homeostasis, okay? So besides the relief fatigue and the enrichment of good microbiota, and the exercise has also correlated to have overall survival, to increase overall survival of patients with cancer diagnosis. This study included cancer patients who exercised, okay, and correlated the frequency and the intensity of the exercise per week. They made 3 different groups, okay? Let's talk about low, moderate, and high. exercise, okay? Talking about the frequency, okay, and the intensity of the exercise. And they made a follow-up of 2 years, from 2 years to 10 years, okay? So as you see in the chart, okay, the patients who with the highest score of hours per week, okay, of exercise, had a better overall survival compared with the rest of the patients, okay? So it is not necessary to make it as really intense physical activity. Only the hours, okay? The ones who had the higher score of hours per week had a better overall survival, okay? So it is very important for you to ask your GIST expert about which type of exercise is better for you, and try to include this type of activities in your daily routine, okay? And remember, intentional physical activity is preferable, okay? Well, we are going to end it up with some, I'm so sorry, with some general recommendations. Okay, the first recommendation I would be giving to you is recovery from treatment and side effects. Okay, please take your time. Please be kind to yourself. You are going through a lot, so take time to rest. Take time for you. Okay, you are doing it really, really great. Okay. The second one, achieve or maintain an ideal body weight. It is really important because overweight and obesity has correlated to increased inflammation. So please try to do a healthy diet, okay? Try to decrease your fat intake from 20 to 30% total calorie consumption. Choose a plant-based diet. Do regular physical activity. Remember, intentional physical activity is preferable, okay? Drink alcohol in moderation, limit the consumption of red and processed meats, okay? Limit your salt intake and drink water. Drink enough water, okay? I remember that, I don't know, on 2020, one GIST specialist told us a really, really good phrase that I learned really well, that she said to us that if it doesn't bother you the times you go to the bathroom, you are not drinking enough water. So please take it account and drink enough water. Your kidney will appreciate it so much, okay? And please plan your meals. Take your time, enjoy it. Feel free to combine and to start seeing your meals and your lifestyle as a key to feel better, okay? Use your food as your medicine, okay? Use your daily lifestyle, your daily routine as your medicine to improve your well-being, to feel better, to have less side effects, okay? And that's for all. Thank you so much for your time. Please feel free to do any questions. Sarah, thank you so much again.
Thank you so much, Bernice. This was fantastic. Great presentation. I have a question from a particular subtype of GIST. This patient has SDH deficient GIST. Wanted to know if you would make any changes or additions to this information. Just sort of like my little note in there, SDH deficient just relates to the Krebs cycle and the fumarate and whatnot. So I don't know if you have information in terms of that Krebs cycle process, but I'll let you answer that question.
Yeah, thank you very much, Sarah. Yeah, SDH deficiency have metabolic alterations. So this is really important to know, to personalize. We are going through again to personalize nutrition. It is important for you to be aware of the metabolism of carbohydrates, okay, because of go through the cycle of Krebs. So you might be needing some, I recommend you to write me to my email so I can help you as a really specific topic, make you some specific recommendations of what to eat and what don't to eat. I will prefer that. Here is my email. I am so sorry if you can.
As you type, oh, okay, great. There you go. You can write that down. Somebody wants to know, what are the raw vegetables to avoid?
The raw, what, I'm sorry, can you repeat the question?
What are the raw vegetables to avoid?
Well, there are several raw vegetables that promote inflammation, such as lettuce. The lettuce, some cucumber, the cucumber, okay? The lettuce, cucumber, the other lettuce, mainly raw, mainly lettuce and cucumber, okay? Why? Because it promotes inflammation, okay, and you might not be tolerating well. There are other vegetables like that can enhance, or you can start. I can go through again through the chart of the foods you can, I'm sorry, here, okay. As you may see, you can enjoy some of these vegetables, okay. These are the ones known to not be inflammatory or not to inflame yourself, okay? So you can rather use this vegetable instead of the other type of vegetables, okay? So you can take photo of this chart, and I can send it this to you.
Okay, yes, people wanted to see the slide deck. That's great. What is your diet recommendation to lessen or prevent muscle cramps while taking Gleevec?
Oh, magnesium. Supplementation with magnesium is necessary for cramps. Okay, so, and you can also drink electrolytes, but we rather recommend supplementation with magnesium because we have found better. This is a better approach for patients.
Okay. And how about the keto diet and adverse effects of sugar on microbiomes? Does intermittent fasting, is that helpful?
Well, keto diet and intermittent fasting have really specific endpoints in the diet. Okay, is to lose weight, not to maintenance the microbiome homeostasis. So I really don't recommend keto diet, neither intermittent fasting, because we don't have to lose weight. We don't want to lose weight. We want a healthy nutrition. We want a healthy diet to can enhance of our microbiome homeostasis, okay, and to cope. And most of our patients have lost a lot of weight during the surgical procedures and the absence of food during a matinee because of the nausea and the vomiting and all these side effects. So we don't want to lose weight over here, no? So I rather recommend a really clinical registered nutrition, a really personalized diet. So not these types of diet which are like more like that are not the objective of our us. Right.
Okay, just to follow up on the magnesium question, somebody wanted to know which type of magnesium or glycinate, if you have any.
There are some tablets of magnesium, like 10 milligrams of magnesium is recommended for cramps. You can find it in a drugstore. I guess you can find it like, or as a supplementation. They sell it without, well, here in Mexico, they sell it really easily, but I don't know in the United States is the same. But it's a supplementation, 10 milligrams of tablets of 10 milligrams of magnesium.
Great. You know, there was somebody who wants to reach out for consultation, so that person should have your email. Maybe you should circle back to that last slide. This person did say that they have a very strict diet with no lectin, no gluten, no dairy diet. They take probiotics, drink kombucha, fermented vegetables and yogurt, but they're still having GI issues daily and losing weight. So just like, you know, what happens when you're still not gaining that weight?
Well, remember about the protein powders, okay? We might need some protein powders. We might need to get some help from these boosters from nutrition, okay? So please contact me so I can know a little bit more about his ongoing treatment or all the side effects. but we can use protein powders. That will really helpful, but we have to find the right protein powder, okay? There are a lot of them in the market, so we have to find the right one, okay? So can help them, or she or him, to improve and to promote the and to promote the sense of well-being, and also to gain a little bit of weight.
Great. Just one last question. I think this is important to state before we end. It did list grapefruit as good, and we just want to make sure that you can address the interaction of grapefruit with imatinib.
No, grapefruit has interaction with imatinib, so we really have to avoid it. Okay, this was general recommendations, but remember, okay, grapefruit has interaction with imatinib. So again, please, these are general recommendations we do, but we also do personalized nutrition in our in Fundación Mexico. So you can reach to us, or you can reach a registered dietitian at your hospital to can help you to get a personalized nutrition assessment. Okay.
Okay, we're out of time. I just want to say thank you so much, Bernice and Fundación Mexico. What an amazing resource you are for this community. I've learned a lot. I'm sure everybody on this call has learned so much from this presentation. So nice that you're making yourself accessible for further questions. So with that, I just want to thank you so much for your time and knowledge today. And everybody have a lovely rest of your day. Take care.
Thank you, Sarah. Bye-bye. Bye-bye to all.